This is a brief overview for our hand IV trainer using a different type of IV catheter device. We are learning to use the BD Nexiva IV catheter system. It does have a few features that differ from the IV sets that you have been trained with. The device is still held from the side aspect. The gray area just below the wings is the moving part that slides the cathlon off of the needle. The white area can be pulled away from the wings, activating the safety mechanism. The gray area has a notch for the finger to use as traction to advance the cathlon once the flash of blood is visualized. These cathlon sets have a built-in reservoir tubing, taking the place of your J-loop or normal saline lock. There is a clamp along the tubing that can be used to stop the flow of blood, with or without distal occlusion of the cathlon. The end of this specific set is capped. Leave the cap on for the skill. Once the skill is complete, this cap will need to be replaced with a primed clave adapter. Priming the clave is best done prior to the IV attempt, just like we would prime a J-loop or normal saline lock prior to initiating the attempt. The normal saline flush is opened as usual with the expulsion of the air bubble. The clave adapter package is aseptically opened and the flush is connected to the lure lock end of the clave. Saline is then gently primed through the adapter. Leave the end of the clave in the packaging so as not to contaminate it. Other specific sets may have a two-way connector at the end of the reservoir tubing. One of these can already be equipped with a clave adapter, and there is often a second clave adapter that can be added after access is confirmed and any needed labs are retrieved from that initial backflow of blood. It is good to look at the equipment that you have on hand to best prepare for the skill. The list of steps for initiating IV access remains the same. Let's review the use of this specific cathlon set. You will notice the omission of site prep and final dressing. That is to help with both brevity and the primary objectives of this video. Insert the catheter with the bevel of the needle up. Once the flash of blood is seen, advance the entire catheter a bit further. Then, using the notch on the gray section, advance the cathlon off the needle. Once the cathlon is flush with the skin, secure the wings with a small strip of tape. Pull the white section of the device back away from the winged area. This both retracts the needle and contains it within the safety chamber. The blood will backflow into the tubing. Once the blood has backflowed all the way to the end of the tubing, close the clamp and then attach the primed clave adapter. Finally, unclamp the tubing, gently pull back on the flush to ensure you still have blood return, and gently flush forward. Before clamping again, make sure to use the positive pressure clamping technique if the site is not going to be immediately used for an infusion. Prior to your attempt at this specific station, select the blood fill bag that has less volume in it and place it lower on the hook provided on the table. This will help create a more realistic flow of blood when accessing the vein.